Is that the only way that you would know? What are the other signs that you're somebody who progesterone just really doesn't work for? Are there other medications that increase those levels that you mentioned? You said LH and
Yeah, well, yes, apparently there are some medications, I think, but I'm not really sure about the safety profile of them to be used
gotcha.
in something like this. There's something that actually almost triples testosterone levels. It's a medication used in both women and men for fertility. And you can actually boost LH and FSH using that. And then theoretically, you could use bicalutamide to block the receptors, but it's having like 3 times the normal level of testosterone in your blood might not be a good thing for
Yeah.
most people. So I'm not even sure how much bica you would need to take to block that amount of testosterone. In theory it could work, but I'm not really sure. We try to stay away from values that are like way off the normal range for and there's one other thing, like I think I was talking about earlier, about there is a conversion gene from progesterone to DHT, and you could potentially, a few of us have blood tests done to see the DHT levels after taking progesterone. So you could see if you have the gene or not. You could see the DHT levels. Unfortunately, it's on the expensive side, that type of blood work. So, but it shouldn't be like out of reach for most people. That's also a good thing to test. So if you're on progesterone for a month, let's say, and you don't want to wait for like 3 months to see if you get hair thinning or anything nasty, you could do that test and put your mind at ease that you're not converting it into DHT.
Is that the only way that you would know? What are the other signs that you're somebody who progesterone just really doesn't work for?
I guess it puts you in a bad mood or depression, because for most girls, like, it actually alleviates depression. So if you're one of those people who gets depressed, then maybe it's not for you. And also progesterone, like, for everyone or almost everyone, causes like hair growth. Like, it doesn't discriminate. So you get hair growth on the scalp, but you also get hair growth on the body. So your hair will grow faster. That's a side effect that almost everyone has on progesterone.
Gotcha. I just recently started progesterone, and my first time taking
Congratulations.
Thank you. Thank you. So far, I think I'm in the group that it is helping. My mental health feels a lot better in the couple days since I started it, but it's only been a couple days, so I don't really.
No, it doesn't matter. It actually starts the first 15 minutes or something.
I felt it in my brain. I felt it right here on the top of my brain. It was the craziest thing.
Yes, it's really fast acting. So no, it wasn't your imagination. Like, you actually feel it. Yeah.
What's the science behind that? Why did I feel it go into my, like, it's like I felt it go up my neck, and then I felt it like sit on the top of my brain. Is that real? Like, I made that part up.
Actually, my ex-girlfriend had the exact same experience described to me that you were feeling. So no, it's pretty common. I felt it, for example, I really have some sleep problems, and like after 15 minutes after I took it, I was like really sleepy. I couldn't keep my eyes open, so it helped me a lot for regulating my sleep. And yeah. But I think estrogen and progesterone and even testosterone, these are hormones that regulate a lot of other hormones. So it makes sense that you would feel it in certain parts of your body, because they have such a wide range of actions throughout our body that, like bone growth and fat deposits. And those are really complex things that affecting like insulin sensitivity of cells and stuff like that. Like the bile I was mentioning earlier, how estrogen affects the bile. Estrogen actually helps the liver in some ways. Like, it actually doesn't help the bile, so it helps you in some ways, but
Yeah, it hurts you
harms you in others. Yeah, exactly.
Are there other hormones that trans women could be missing on? Like, for example, if you don't take progesterone, you might be low in progesterone. It might make you depressed. Are there other things that you found with your group of people that are like, I don't want to say ailments, but like, there's not a lot of research done for trans people, as
yes.
you know.